And Dr Vaughan, let me just tell you what Downing Street said in response to Dominic Cummings. They said that the Prime Minister doesn't share Mr Cummings' description of the Department of Health as a smoking ruin and says COVID challenged health systems around the world. Who, in your opinion, is right?
Well, I'm very worried that there's a lot of blame shifting going on here and political posturing and point scoring. Bottom line is that colleagues of mine have, across the country, have given their lives on the front line to save as many lives as possible. And what we should be doing now is to try and actually fix the issues that led to the avoidable deaths. We need to look at why, in the early days of the pandemic, we let 18 million people fly back into this country and quarantine just 4 flights. We need to look at why, particularly in the autumn, when we could have learned the lessons from the first wave, we were not taking notice of SAGE, who actually said that we should have done a lockdown in September. And we need to fix and make sure that our public health systems are robust, because this isn't just going to go away. It's very likely that this is going to be part of our life and future, and we have to get the basics right. The messaging was wrong from the beginning. GPs were having to tackle queries, patients turning up or ringing up with coughs, and they weren't actually able to get them to isolate properly because they were being given the wrong advice. Like if they'd come from northern Italy or China, they couldn't then strictly tell them to isolate. People weren't actually supported to isolate. People have had to, they've got their jobs to go to because there wasn't clear messaging. And I have to say, Dominic Cummings is one who went against the lockdown and didn't actually set the best example himself in the way he behaved with the Barnard Castle incident. So, let's learn from the mistakes and let's fix the things that need to be done in future. And I want to honour the colleagues of mine in the NHS who've given their lives. And the only way we can do that is if we learn those lessons and get things right next time.
Yeah, well said. Well, and Dr Vaughan, let's have the last word from you. Perhaps you can sort of wrap things up for us as someone who has very much been on the front line over the last year and know many, many colleagues who have done such sterling work. What's your summary, really, of where we've been and where we're heading?
Well, I think it's a bit sad that all this debate now seems to become a lot of this is all about Dominic Cummings. Can I just say that the heroes of the UK's response to COVID have been working on the NHS front line, and I have been privileged to work with them. And as I said, we've lost nearly 1,000 lives on the front line to COVID. Amongst NHS workers. So the heroes are the NHS workers here, and I want to essentially talk about our nurses, the fact that they are now burnt out. They need our doctors, they need support. We need more money in the health service. We need to sort out the fact that we've got 4.3 million people waiting on our waiting list. There is so much that needs to be sorted out that if this debate simply becomes about political point scoring and who did what and won, then we've lost an incredible opportunity to be better next time. And you have to make it easy. I want to give a shout out for the public here because they did their best, I think, in the first wave. And I think what went wrong there was the mixed messaging. And you have to make it easy for people to do the right thing. So we need to invest in our healthcare. We need to invest in our healthcare workers and look after them. And we need to respect the public and support them, because I think that's also what went wrong in the first wave.
OK, fascinating speaking to all three of you.